Here's an interesting topic, gluten. Gluten-free, you see it listed on items in the grocery store, and we seem to hear about a lot of people with gluten sensitivities. But a professor of gastroenterology in Australia, he's making waves this week, saying that gluten sensitivity doesn't exist. So we wanted to know what our local health experts thought about this. Is there such a thing as being sensitive to gluten other than having celiac disease, or is it all in our heads? Celeste Rodriguez, she'll break it down, if I can say her name right.
Hey, good morning, you guys. Yeah, we're talking about, gluten-free. Do you believe you're gluten-free? Do you need more information about this? What about celiac disease? We have Dr. Pearl here to give us some information on this. Thanks for coming in, Dr. Pearl.
You're welcome.
Appreciate it. So tell us about this. So there's a new study, actually, that, tell us about this new study.
Well, there's a new study by the gentleman who actually kind of described this gluten insensitivity, which is different than celiac disease. And he was not satisfied with some of the findings, so he went and restudied another group of people. And now he's questioning whether some of the gluten insensitivity may be related to other things that are contained in bread, such as some of the alcohols, the short-chain fatty acids. And so some people get better when you take those away as well. Now, it's different than celiac disease, which is a known entity, and there probably are people that are gluten insensitive, and then some that it's probably something else in those products that's bothering them.
Let's talk about that. Is it too strong to say that might be something in their head, you know?
I don't think that's usually the case, although there are people that have related to gluten to certain neurologic or psychological issues, depression, autism, things like that. There's really no evidence that it affects that. But certainly in the GI tract, it does. If you don't tolerate it, you will have some of those symptoms.
Now, it's probably a good idea for folks then to get tested, right?
If they think they have those symptoms, the first thing is to get a blood test. It's a couple of vials of blood, and they look for that antibody against gluten in your bloodstream. If that is positive, or you really still have a lot of symptoms related to that, the only way to definitively diagnose it is to get an intestinal biopsy. So they would do an endoscopy of some sort and take a little sample of the intestine and then determine that. Once they're diagnosed with celiac disease, it's not a matter of just going gluten-free. They have significant nutritional deficiencies. They may be anemic. They may have had weight loss. So a lot of these products that we have here are designed to kind of re-nourish the body with a lot of the minerals and vitamins that they're missing. And then even when they're on a gluten-free diet, it's a nice idea to take those supplements, because a lot of the gluten-free products that are out there don't have all the additive supplements that we see in most of our foods that we buy in the grocery store now.